benefit advisor with Benefit Insurance Services in Sacramento. I'm here to talk to you today about various definitions of your health plan. The first is copay. A copay is the amount of money you pay when you go see the doctor or receive other services. Generally, copays do not apply to the maximum out-of-pocket of your health plan. The next definition is deductible. A deductible is the amount of money that you as a subscriber would spend when you incur services. This amount of money could be $250, $500, or even $1,000. The deductible comes before the coinsurance, and the coinsurance is the amount of money that you share with the insurance company for those services. It could be you pay 20%, the insurance company pays 80%. It could be 30-70, 60-40, 50-50 splits, depending upon the plan design of your health plan. Your coinsurance applies to the maximum out-of-pocket of your health plan. The maximum out-of-pocket is the annual maximum risk that you or your family would be faced in a catastrophic situation. Some plans have a $3,000 for the individual, $6,000 for the family, $4,000 for the individual, $5,000 for the individual, and again, it's generally doubled for the family. This particular number can change during your open enrollment period every year. So it's a number you should pay attention to when going through your open enrollment materials. My name is Vinny Catalano with Benefit Insurance Services in Sacramento, California, and I hope you benefit from this information.
When I became superintendent, I did not want to become an insurance broker. However, I knew that it was essential for me to understand the manner in which insurance operated, understand the terminology within the insurance program. Because if you don't understand that terminology, you surely cannot manage that program effectively. And so many of my fellow administrators poo-poo this. Somebody else's problem. It's the treasurer's problem. Well, we've already established that if that program puts the school district in bankruptcy, it's going to be that school administrator that's probably going to lose their job. When I took over as superintendent, our healthcare program was about $1 million in debt. And that's one of the reasons that I knew I had to become knowledgeable about health insurance. Not something I wanted to know, but it's something I felt I needed to know. And these terminologies helped me understand when I was talking to the insurance broker, understand those terms. Vinny's back.
My name is Vinny Catalano with Benefit Insurance Services in Sacramento, California, and I'm here today to talk to you about the prescription drug benefit of your health plans. Generally, there are 2 or 3 tiers associated with your drug plan. The first tier, and the least expensive, are generic drugs. Generic drugs are the ones that have come off patent and are produced by third-party providers. They have the same efficacy as brand name drugs, but they're much lower cost. The second and third tier of drugs are brand name drugs. And these fall into 2 categories potentially. Those are brand name formulary and non-formulary drugs. Formulary drugs are those which your health plan approves and is on their list of approved drugs that are brand name. Those will cost you less than non-formulary drugs. Your health plan may restrict access to non-formulary drugs or may not make them available to you at all. These drugs will cost you more and are in the third tier. Also, in some cases, you will have a drug deductible for brand name drugs. This could be $150 or $250 in a calendar year. One way to mitigate drug costs is to utilize the mail order component of your health plan. In the mail order component of your health plan, you can get 90 days worth of medicine for the price of 60 days, or basically 3 months for the price of 2. You basically have to fill out a form, send it into the mail order component of your health plan, and then basically manage it online, just like any other e-commerce purchase that you make. My name is Vinny Catalano with Benefit Insurance Services in Sacramento, California, and I hope you benefit from this information.
Back to our insurance committee. The individuals, the experts that we brought in to share with our staff, they basically told us in no uncertain terms, if you are on a maintenance med, you must use mail order script. The cost is going to be minuscule in comparison to going to the pharmacy and getting it straight over the counter. In the meantime, that mail order script that we participated in was in a network. They haven't explained network to you real well, but network means that you, physicians, pharmacists, pharmaceutical companies contract with insurance companies, and the larger the account, the less the cost. And therefore, they are interested in participating in a network. Physicians might participate in a network. Another thing that we discovered in our analysis is our hospital, our local hospital, was not in a network. Therefore, whenever any of our staff members went to that hospital, they were paying premium dollars. The individual who was advising our group said, we need to change that because the hospital is our #1 provider. Of all of our services, they are our #1 provider. It was decided that we were going to use an orange card mechanism. I kind of chuckled at this when I heard about it. He said, we're going to give all the employees these orange cards. When they go into Southeastern Regional Medical Center, I want them to take this orange card and hand it to the individual and say, why isn't Southeastern Med in a network to help us? I kind of chuckled. He said, oh, by the way, he said, I represent the other three schools in the area, and they're going to be doing the same thing. 1 year later, in a network. Unbelievable. And the amount of savings was significant, to say the least. Just a few more terms here. Let's talk about organizational structure. Organizational structure. The first one is entitled fully insured. What that means is that the school district contracts with an insurance carrier, and all the claims are just processed from the employee to the insurance company, and the insurance company then pays the claims. Do any of you know whether you're in this type of plan or not?
Could you say that again?
A fully insured plan is one in which the school district contracts with an insurance company or a carrier, and those claims are just processed through that company. That's fully insured. Very few schools around here are like that. The next one is called self-funded. Now, within a self-funded program, what that means is that all of the claims the school district is going to be responsible for. And I'm going to bring up this other word here, consortia. How many of you participate in OMARISA? I see a couple of hands here, 3 or 4 hands. That is one of the largest providers or structures organizations that exist around here. Many, many schools participate in this type of structure. The advantages of self-funded consortia. Once again, I want you to understand that if a school district experiences poor health among its employees, or there are catastrophic illnesses, that school is going to pay dollar for dollar for those costs. They're going to pay dollar for dollar for those costs. Now, in the meantime, the employee is going to be paying their deductible. They're going to be paying those out-of-pocket expenses. They'll be incurring those costs. But the majority of costs is going to fall upon the school system. When you are in Omarisa, you participate with all the other schools. And if you experience a bad year, you are allowed within that structure to borrow the money via a school that has had a good year. And by the way, one thing about health insurance is it cycles. You might go 3 or 4 years and have very good experience. Then all of a sudden you might have a lot of what is called stop-loss claims. A stop-loss claim, anybody know what a stop-loss claim is? Not heard that term? Typically, in Omarisa, it's $30,000. If an individual has $30,000 of health care expenses in a year's time, that is considered a stop-loss claim. Omarisa not only gets an insurance carrier, they also get a third-party administrator. We'll be talking about that here in a minute. And they also get stop-loss insurance. Now, what happens for a school district with stop-loss insurance is that when that individual gets to the $30,000 claim, the insurance kicks in. Therefore, the school district is not liable for all of those incurred costs. But stop-loss insurance is extremely expensive. Therefore, the more stop-loss claims that a school district has, the higher their premium is going to be in general. So that's fully insured, self-funded, and consortia. Benefit design, what that means is, what benefits do we offer? What benefits are there? What are the limits of those benefits? What's the deductible, etc. Experience rating. You heard me use that word experience. Experience, once again, has to do with how healthy the individuals who are covered on the plan are. And if they have good health, the following year, probably the premium that the school's going to pay is going to drop. If they have bad health and a lot of stop-loss claims, their premium is going to go up. Stop-loss coverage. I got ahead of myself a little bit. Once again, stop-loss coverage is when an individual reaches a catastrophic claim level. And at that particular point, this other coverage takes over and assumes some of the dollar-for-dollar expenses. When individuals are under that catastrophic situation, the school district in a self-funded plan is paying dollar for dollar for what is used. Network. You've heard me use that a couple of times. Basically, that is a group that participates in order to provide less costly services. In the meantime, what's in it for those physicians? What's in it for the people in the network? Well, they are going to be assured that they're going to be getting all the people in that plan. Therefore, they consider lowering the price. Premium. Premium in all insurances is how much you pay. School district's premium is, our school district was paying about $90,000 a year in insurance, health insurance costs. Third-party administrator. Third-party administrator, that is a group that manages your claims. Stacy, you should rest assured that you are going to want to ask some questions when you interview about these coverages, who's responsible, and the big question I would ask is there a third-party administrator? Because if there's a third-party administrator, all those claims are going to be sent to that third-party administrator. And that third-party administrator is going to help manage the program. If there isn't a third party, if it's a fully insured program, typically it rests on the treasurer to manage those claims, answer the questions, those types of things. Usual, customary, and reasonable fee. You heard Dr. Lewis talk about that. In the industry, there are those usual and customary prices. What does the third-party administrator do? Well, not only do they manage your claims, but they also watch over your account. And for an example, if a physician is costing more than the usual customary fee, that third-party administrator might get after that physician and say, hey, why are you charging excess costs? And depending upon what they say, they'll be running that interference for the school district. Wellness programs, you really could tell that that was dated, Dr. Lewis's clip, because most companies these days have wellness programs. They pay for checkups. They pay for preventative types of situations. And so now we are much more involved with wellness programs, and it's been proven that when you have a well-established wellness program, those illnesses might be caught sooner than what they would otherwise. And in some of these wellness programs, there are incentives.
Discounts.
Oh, and or discounts, yes. Definitely some of those types of things will be in play. Just a number of areas where schools can contain costs. Schools can contain costs by increasing employee responsibility and their participation. Our insurance committee did that. Our individuals realized there was only so much pie, and they were going to be good consumers and try to contain those costs. When you have that type of situation, rather than carte blanche, that will be a savings for the school. Wellness program. Pre-admissions, pre-certification. Many of you might be involved in pre-admission, pre-certification. We have two individuals who are going to be going to the doctor here fairly soon, I'm certain. And if they have pre-certification, pre-admissions, what that means is when they go to the hospital, they are going to hand their insurance card to them. If that is marked on there, the third-party administrator is notified, and they start managing the plan. Therefore, if the physician is going to order an extra set of ultrasounds that are considered to be unnecessary, third-party administrators are going to say, we're not paying for that. That wasn't necessary. And so pre-certification, pre-admissions can save the school money. And it really doesn't harm the integrity of the program much. Utilization review organization, managed care. Someone managing those accounts. If you don't have that, nobody manages it. Maybe the treasurer would manage it if they would be so inclined, but generally no one manages it. One of the things that we discovered as we did our utilization, and we were provided those information from that group, is we, as a group, were not using chiropractic care much. However, we were paying, and it wasn't significant, but we were paying for a limitation much higher than what we needed. And therefore it was recommended to us to reduce that limitation. And through our negotiations, our committee made a recommendation to the negotiations committee, and it became approved. And therefore chiropractic care was reduced, saving us more money. Networks. And you can participate in a lot of different networks. And once again, that drives the cost down. Using mail order script, we've already mentioned that. Offer incentives to use spouses' health care. If one individual is working in the schools, the other individual is not, then there might be an incentive to get the person to go on the family plan other than yours. You smiled. I'm guessing you know a little bit about that.
When we for local, we don't offer, for example, when there's two teachers, you have to take the spouse's coverage. But I know in other districts that you're offered an incentive sometimes because that's a benefit. That's one of my benefits, but I'm denied that benefit because I'm married to someone in the district.
Yeah.
So I can't.
And you're right. You're right on point. Many schools where there's a husband and wife in the same district, rather than having two family plans, you only need one. Therefore, the school is going to save money. And most generally, they do provide a $500 stipend for that individual to be on the one family plan. Reduced benefits and reduced limits. Once again, when you reduce the limits, you reduce the benefits, that's going to affect your plan. Although you have to be really careful here. I can remember us talking about alcohol rehabilitation services that our plan offered. We had not used that at any point in the recent history of the school. And I proposed that we reduce the limit. And somebody said in the committee, well, geez, what happens if it has to be used next year and we won't have it? That's the risk that you take. And I don't think I got that accomplished. I don't think we were able to convince people that that would be worthwhile. And probably still paying for something that's not being used. And that's the idea of consumer-driven, is paying for what you need and taking care of individuals. Changing plan types, if you go from the PPO to an HMO, causes all kinds of commotion in the school with the staff, but it can, in fact, be beneficial, save some money. John, when you guys went to an HMO, you probably weren't there, or were you?
No.
No.
It was been HMO, wasn't all of that.
Yeah.
But actually, our plan did just change. We went from a copay to a deductible system.
Okay.
Just this year, and I mean, they saved a boatload of money.
Those kind of things can save money. And once again, doesn't have to harm the integrity of the program. That's the key right there. It doesn't have to harm the integrity of the program. Just a quick couple of comments, and then we'll take a break. Employee dental insurance. Some schools offer employee dental as a benefit. Not very costly, I might add. Compare that to your group health care, minuscule amount there. Oftentimes you might have to have another card to show the dentist when you go there. Vision. Probably of these three, this one is the least that's offered. How many of you know if your school district has vision? Yeah, 5, 6, wow, that's much higher than I would have thought.
We pay more extra to get it. It's not very good, but it is something. We pay like $8 or $9 pay extra. We
Yes.
got that a few years ago.
One of the things we did is we went to HMO steerage. What that meant was that in the admission period, an employee would make a decision if they would want to go into an HMO or a PPO. And if they went to the HMO, what's that going to do? What's happening with the HMO if they choose an HMO? Todd, give me what's going to happen with that HMO.
I mean, as far as with
The doctors they may use.
it's limited.
It's
very
limited.
limited.
Very limited. And in the meantime, it's going to drive their price down. So that was going to be a savings to the school. Therefore, if they elected HMO for a year's time, then we were going to give them free vision coverage. If they elected PPO, we did not. And we left it into another thing that's key with the health insurance program. You've got to put choice in front of people. Let them make the decision. If you let them make the decision, it's better than you trying to force the decision down their throat, so to speak. The last one is term life. Who can tell me what term life is? John?
Basically, they give you a life insurance policy for the time that you work at that school district. As
Yes.
soon as you, oh, I'm sorry.
Yeah,
As soon as you are done, the policy basically terminates.
yes. And the other part of the term life is it does not accrue any funds. If you have whole life, as you put money in the program, you get a return out of it. You do not out of term life. Term life, very, very inexpensive, and just very, very expensive. So, the insurance program that a school offers is very costly for the school district. Being good consumers can assist districts in driving those costs down. If you get an opportunity to participate in an insurance committee, I would suggest you do it, because if it is truly a good committee, I can't guarantee that, but if it is a good committee, you will learn one heck of a lot about insurance. And many, many negotiated agreements these days do have insurance committees as part of their negotiated agreement. With that, let's take a break.